I've had my own knee problems and they are debilitating. I didn't realize how debilitating they were. And so we start not wanting to do the things that we love to do. Hello, Dr. Steve Nagel here, 180 Health Solutions. If you're seeing this, you probably got some knee problems, or maybe someone you love does. I get it. Even just going up and down stairs or getting up and down from the floor, trying to go for a run, getting in and out of a vehicle, right? The basic things of life start to actually get really hard to do and get really annoying, and it causes a lot of problems, right? Maybe you're young, right? Where the likelihood of recovery is a lot better. Maybe you had some surgeries or an injury and you just haven't recovered. We can help with that. But most people, it's when they've gotten a little bit older and their knee starts to wear down. Maybe they're in your 30s or 40s and you're starting to lose your ability to have function. Or maybe you're 50, 60, or 70 and you've been told that you have degeneration, right? Or you've told arthritis or bone on bone. I can tell you, that's not a death sentence for your knee. There's degrees of bone on bone. There's degrees of arthritic changes. And if you can get it within those first 2 stages, if we can help you before it gets to the point where there's no return, there's a lot that can be done to restore function. We get to see this every day. Will that knee ever be perfect? Maybe not. But can we restore function? Absolutely. And what's the difference between maybe what we do and what somebody else does? Well, maybe you've been told you need a cortisone shot. The downside to them, they might make you feel better. But what happens is those shots actually make that very tissue they're trying to help degenerate and break down faster. We have technology that's been shown to be more effective and safer than cortisone shots. Maybe you've been told you need surgery. Well, you can't go back from a surgery. And most people want to avoid surgery like the plague and try to do everything that they can because there truly is no going back once you have that surgery. There is hope for you. I had to fix my own knee. And then when I figured out how to fix my own knee, I said, you know what? I need to bring this to my community, and that's what we're doing. That starts out with an evaluation. We sit down with you, we figure out what your goals are, we figure out more of a timeline, what's been going on with your knee, maybe discuss other contributing factors that you want to get handled at the same time. Maybe if that's a goal of yours, we need to get some weight off to take stress off that knee. Maybe we need to start changing some lifestyle factors that are creating more inflammation, which makes a person sore everywhere. Or maybe you just want help with the knee. We get that and we're fine with that. We do an evaluation, figure out where the injured tissue is, and then we do some basic movements to try to recreate the pain. And then we do the coolest part called the trial treatment. The trial treatment lets us know how your body's going to respond. And you'll know too, because people will see changes, right? Are we expecting a massive change immediately? Not necessarily. It may be just a small change, right? You maybe have a 10, 15, 20% improvement when we retest the same tests that we did prior. That's what we're looking for. It's not an immediate fix, but what that lets us know is that with time, that those changes can become more and actually will become more and more sustained improvement as well. Again, that trial treatment is not a fix. It's not going to last. It gives us an idea of how you're going to respond to care. So if this sounds like something that you want to pursue, if you're looking for true approaches that actually aim to realign, to restore, to heal that joint, decrease inflammation and restore function over just simply numbing the pain or helping you feel better while it continues to break down, I want to meet you. My staff wants to meet you. We want to get you help. So click on the button below, make your appointment. If you need more information, click on the button below as well. And there's a longer form video to follow. I'll talk to you soon. Have a great day.